Hi everyone, welcome to lesson 2 of the Human Resource Management course in healthcare. Okay, today we're going to be looking at the different types of health professionals that are out there. Okay, we're just going to kind of go over professionalization. We're going to look at different types of healthcare professionals. We're going to look at what nurses are dealing with, pharmacists, allied health professionals, and healthcare administrators. Okay, so healthcare professionals, who are healthcare professionals, right? Well, healthcare professionals are clinicians, like practitioners, those physicians, nurses, dentists, physician's assistants, any kind of technician out there who works in healthcare. Also healthcare administrators, so like us, right? And then we have allied health professionals, okay? So as we move forward, let's kind of define right now what an occupation is and then what a profession is, or a professional. Okay, so first, an occupation is someone who gets paid like a wage, like maybe an hourly rate wage. They usually don't have high skill specialization, and they're usually working in a situation where they do require a supervisor. Okay, there's usually someone out there who is going to sort of oversee what they're doing. Many times they'll give them instructions or, guidance throughout their, time that they're working, or they may even have like a list of things that they have to accomplish before their time, before they clock out of the day, right? So that would be more of an occupation. It's a job, right? A professional, or someone who has a profession, this is someone who has highly specialized knowledge in a particular area, right? This type of a job is going, or this type of of a worker, of a person, is going to have way more authority and responsibility in their job and their duties and what they do, and even they're going to have so much more autonomy in just how they carry themselves throughout the jobs and like what they do. This type professionals usually are not going to require supervision. Okay, so they're not necessarily going to have someone standing over them, directing them, telling them what to do, giving them a list at the beginning of the day, and telling them you have to check all these things off before you clock out. Okay, so usually they don't have that whole clock in, clock out. They're not going to be paid on like an hourly wage or anything like that. So anyway, where we're going in healthcare right now, healthcare is starting to evolve. Okay, so more and more we are starting to create a situation where we're going to have more and more professionals doing less work. Okay, and these professionals are going to be more supervisors. Okay, and they're going to supervise the people that are functionally trained. So what do we mean by functionally trained? Functionally trained are those people who have those occupations, who are going to hold the occupations, who are going to not necessarily have specialized skills, but they are going to know the different duties and things like that you have to get done, in this particular field or this department or this whatever you're doing. And so those who are functionally trained, they are able to perform tasks. They don't necessarily they're able to teach the theory behind. They don't know really the theory, or they don't study the theory behind the work that they're doing, but they know how to do the work. Okay, so the professionals are the ones who are going to understand the theory behind everything. They can form new theories. They can, do a lot more. But what they are going to do is direct and guide the people who are functionally trained to do the actual work. Okay, and then those people are going to do the work, right? So we need more functionally trained professionals, or functionally trained workers, and then we're going to have more professionals who are able to train and guide those who are functionally trained. Okay, so, and as healthcare evolves, we get into the situation where we need more and more people to be like empowered, okay, and where they don't necessarily have to work under direct supervision. So in that case, functionally trained individuals will come in handy because although they still have a supervisor, someone who's sort of on top of it and supervising, but they will know exactly how to perform tasks. They know how, given like whatever department it is you're talking about, or what type of treatments you're rendering or anything like that, these individuals know exactly what to do, and only at a certain point where it goes beyond their skill set and where theory becomes essential is when they're actually going to need guidance from a professional. Okay, so before that even happens, they can perform the jobs, and that's where we are going with healthcare. We're getting more and more people who can be more functionally trained, where we have professionals sitting out there and creating the theories and the duties and supervising and guiding the functionally trained workers to do these jobs. Okay. So assessment is when you're going to look at your patient. God, okay, those were the 5 essential. I keep doing this. I can't even go back. Anyways, we're just gonna move forward. Go ahead and look at that. You definitely have access to all of these PowerPoints on the website at professorhussein.com, so they're all there. You can go ahead and look at this yourself on your own time whenever you need to. So anyway, now we're gonna look at pharmacist right now. Okay, so pharmacist, there are 2 main degrees that you can get if you're going to be a pharmacist. You can get an RPH degree, or you can get a PharmD degree. All right, so this one, your RPH, this is usually you obtain this through a bachelor's degree program. Okay, and the type of jobs that you can expect to get with an RPH degree would probably be more like a retail pharmacist job. Okay, which is great. That's totally cool. And then you have the PharmD degree. So if you're going after the PharmD degree, this is the doctorate level of pharmacology. Okay, so if you're going to do this, you're going to become a pharmacist. You're going to be a doctor of pharmacology or pharmacy. And this type of a pharmacist can work in hospitals. You're not necessarily limited to working in a retail pharmacist. You can work in hospitals, you can work in academia, you can teach, you can do research, you can be part of an integrated part of the healthcare team where you're working with physicians and nurses and everyone else who's part of the hospital, and you're part of a group of individuals who are all playing their role in taking care of a patient, okay, and figuring out what the patient needs and how we can make this patient better. So anyway, both of these different types of degrees will definitely have to be board certified by the state, right? That's essential. You cannot practice unless you have that certification by the state. And also, we're noticing now that, because for a while there, it was like if you have the RPH, that was pretty darn good. And you can go ahead and go off and be a retail pharmacist, and what else do you want in life? But now we're noticing that a lot of facilities, a lot of organizations really do like when people have the PharmD degree, because they can do so much more with them. You have the PharmD degree, you can do a lot, even though yes, they have to pay them more, but there's so much more that they can get out of someone who has a PharmD degree than an RPH degree. On the other hand, well, not necessarily, because if you have your PharmD degree, and even if you are working in a retail pharmacy or anything like that, you can have a lot of the pharmacy technicians to fill prescriptions and do things like that. Okay, so we're seeing a lot more, a lot more people A lot more companies happier about the PharmD degree. Okay, so anyway, moving on. So now let's look at allied health professionals. Okay, so this group of professionals, this is like a category in its own where it's pretty much everyone outside of the typical standard healthcare team. You know, whatever we normally think of as like part of the healthcare team, where it's like your physician, your nurse, your pharmacist, your this, your that, you know, those people that we normally always think of, they're part of medicine, like that's it. Those who are outside of that, but still are health professionals and still are part or an essential part of how we do healthcare delivery in the United States. Most of those people are what fit into the allied healthcare professional category. Okay, so a lot of these services or these type of professionals work in disease prevention, nutrition, rehab, occupational therapy, things like that. Okay, and most of these different professions will require you to have a licensure or a certification by the state. Okay, you won't necessarily be able to practice unless you're board certified by the state, or you have your state licensure or something, whatever is required for that profession. Most of them will require something like that. Okay. These days, where we are going in healthcare is we're evolving so quickly, and I think that we can all feel the change in the energy, and we're moving so fast, and since the energy is moving so fast, we're evolving so quickly. We're coming up with new technology left and right, and since we're coming up with so much, technological growth, we are in this situation where we suddenly need new professionals who are going to be able to use this technology. Okay, we have a need, well, not necessarily a need, but we do, because we have all this technological growth, we have so many people who are trying to specialize. Okay, so people who are specializing in certain areas, and they're coming up with more technology. And then the way that our evolutionary growth is going in healthcare, since we're coming up with new treatments and new technologies, that's going to require new professionals, new technicians, new people who can handle the new technology and who are specialized or who are trained in working with those particular treatments, that particular technology. Okay, so we are actually kind of specializing in like different treatment plans and different things like that, and we're less and less general. Okay, that's just kind of where we're going now, right? And so anyway, and a lot of what is also contributing to this is the fact that we have this ever-growing aging population. Okay, so we have this aging population that is in dire need of more healthcare. Okay, and the more we grow, more our aging population grows, the more healthcare, the more long-term care services that are going to be needed, and the more work that we're coming up with, the more reason for specialization and more technological growth, because now people are getting all these ideas and going, we can probably make this easier. We can do this. We can cure this with this. So we're coming up with so many new treatments, so many different services that we can start providing for our patients, especially our aging population, and that is where we're going. Okay? And in addition to that, we're coming up with new ways for us to even deliver healthcare. Okay, so it's not always going to be your standard hospital or your standard doctor's office. We're coming up with new ways that we can render healthcare. We see mobile vans, mobile clinics, and diagnostic, centers and vans that kind of give out like prostate exams and other things like that. Check if you're diabetic and whatnot, all over the place. A lot of that is happening. And we're also seeing a lot of telemedicine becoming more of a thing, although it hasn't been fully integrated in the way we do healthcare. Telemedicine is actually starting to become a thing. Okay, so what is telemedicine? That is when you're able to receive care from your practitioner, your psychologist, your primary care physician, your specialist, whoever. You're able to receive care from your practitioner remotely. You don't necessarily have to be in the same room and sit there during real time anymore. Okay, and we're even finding, I think now that we have this whole coronavirus thing going on and we're all being quarantined, it's giving us a lot of ideas, and we're figuring out a lot of different ways in which we can do our work remotely. Like, what am I doing right now? Okay, I'm pre-recording all of my videos, all of my lectures to give to you guys. Okay, so that way I don't necessarily have to be there in person, since we can't, and we don't even have to be there in real time. Okay, I can do all of this ahead of time, and then I can just pass this on to you, and then you guys can refer back to it, and you guys can have access and use this information whenever you need it. Okay, and so we're finding different ways that we can connect and we can do this stuff, but remotely as well. So we're suddenly coming up with all these different ways now. Telemedicine is definitely going to grow in the future, and that is also going to be a new way for us to deliver healthcare. Okay, once it becomes fully integrated into our healthcare delivery system, and we'll be able to figure out exactly how we need to, how we're going to be able to monetize it, and give reimbursement out, like how Medicare is going to reimburse for telemedicine care that is provided to patients. That is going to be really the future, and that's going to provide access to care to so many people, because when you don't have to physically be there, that saves a lot of energy, a lot of time, and things like that, and we can get a lot more done. Okay, we can be more efficient. So that is also another way that healthcare is transforming. Okay, so healthcare professionals, healthcare administrators like us, in healthcare, we are there to help organize, coordinate, and manage the whole healthcare system, manage the whole healthcare facility, or depending on what your role is in that particular organization. Okay, so we're the ones who are doing the scheduling, who are doing the forecasting for next week or next month. We're the ones figuring out how many employees we're going to require to be here, to be working in the hospital, working in this facility. We're the ones who figure out exactly how many how much resources, how many supplies we need for next month, next week, and we can place orders, and we can kind of, come up with ideas. We come up with ways to market our brands and things like that. So organize, coordinate, and manage the whole healthcare facility or department or system, whatever it is, whatever scale you're working at, right? So that's really the overview of like a healthcare administrator and the different types of jobs you would be doing. If you're working in health administration and you have a bachelor's degree, you're probably looking at working in like the line manager level of a department or an office or something like that, right? Or administrative assistant, things like that. Usually for the higher levels or more of an executive level or anything like that, they will require you to have a master's degree. Okay, most higher level positions in health administration will require a master's degree or higher. Also, many physicians out there are also executives. I know that a lot of MD programs will offer a supplement like MPH or MHA or even an MBA. Okay, so that when you become a physician, you have that degree and you can be an executive eventually. Okay, or you can also own your own practice or whatever you want to do with that. So Then we have the role of the HR management in healthcare. So some of the essential duties that a manager would be doing, or essential HR tasks that a manager would be doing in healthcare, would be checking the qualifications of all your workers, all your employees, even the physicians. Okay, so you always it's super necessary, especially in any facility in healthcare. You have to check the credentials, okay, the education and everything like that of all the clinicians, all the healthcare workers, all the employees, everyone that works in your facility. Okay, verifying credentials is super important. I mean, what would happen if your facility was not necessarily keeping up with all the different certifications that, let's say, your nurses had, okay? And maybe some of your nurses, their certifications maybe for like CPR or any of the other things that they have to be certified with, what if they were about to expire? Okay, and you weren't paying attention to that, and the nurse might not be paying attention to that, okay, because they're too busy working and being stressed out. Maybe they didn't pay attention to that. Well, what if the due date passed and their certification expires? And then what if you have a situation in which that nurse accidentally makes a mistake, a medical error happens, and it puts this patient in danger? Your facility is in huge trouble because that nurse, their certifications expired, so they weren't even allowed to be doing what they were supposed to be doing. They weren't certified to do what they're supposed to be doing. So you guys are in huge trouble if you let something like that happen. Verifying credentials is a huge, huge HR task for those working in healthcare. Okay, also education services. It is really important for you to offer ways in which your employees, especially nurses and other practitioners like that, to be able to develop their skills and to grow. Okay, healthcare is always changing. It's always growing. We're always discovering new services, treatments, even having new medical technologies, or just new stuff is always coming up. We have to make sure that our professionals are educated. Okay, they have to know all the latest advancements. They need to know what's going on and how to better care for the patients. And if they don't, then that puts your organization in jeopardy. Okay, that's not allowing your organization to keep up with the demands of the industry. Okay, and then practitioner management. This can be a tricky one because you are definitely going to be managing your practitioners, right? Many times they might not like that, but you still have to. What would happen if you had an impaired practitioner, a practitioner who might be under the influence of something, or even maybe that practitioner is going through something in their life. They're extremely depressed and they're not in the right mental state to practice medicine. You have to be able to take appropriate action, okay? Because if anything happens and that practitioner endangers a patient, it's on you, okay? Okay, so the healthcare profession has changed dramatically, so much so over the years. It's been pretty crazy. So we've reshaped a lot of our boundaries. The outcomes of healthcare interventions have changed so much. We start thinking about the quality of life differently. We prioritize certain different things differently than we have in the past. And there are actual 3 huge changes that have happened in the past that has sort of shaped the way that we are doing healthcare today. Okay, so first of all, I want to talk about technological advances. Okay, so the more, and this is probably obvious to most of you people, the more we develop this technology, the more we are able to innovate and whatnot, the more healthcare grows, and the more our perspective changes on what's important in healthcare, the more we need different types of technicians and other types of workers. Okay, so we keep having to redefine how we do healthcare delivery, and then the different types of professions and technicians and whatnot who deliver this treatment in healthcare delivery. Next, let's say this was the late 80s, right? This was a huge thing that happened, and it totally changed healthcare delivery like forever. We could never look back again. It was when basically Medicare. This started with Medicare. Okay, let's blame it all on Medicare or the government. I'll put that right here. It's Medicare's fault. Okay, so Medicare decided to switch the way that they were going to reimburse the different facilities. Okay, so they used to do this thing called, I'm going to put it here, cost plus reimbursement, right? And then they switched it to this thing called prospective reimbursement. Okay, so when they totally changed the way that they're going to reimburse these facilities, it shifted the way that these facilities are going to start prioritizing their patients and then the resources and everything like that. Because the shift started making, basically, it made it impossible for a lot of these organizations to make as much money off of Medicare as how they did in the past. Okay, what prospective reimbursement did was it suddenly made, Medicare decided that they're going to pay everyone just a flat rate, okay, per diagnosis, flat rate. So that means you don't get to bill for all the extras that you do for the patient. You don't get to bill in Medicare and be like, well, look, we already did this. We're having them stay overnight. We're, feeding them. We're giving them this extra treatment. We're doing this. No, you're not. You can do that, but it's on you then. Medicare is only going to give you a flat rate, a flat amount of money per diagnosis. So if you do extra things for a patient, you're not going to make any money. You're not going to make any money off of that patient. You might even go broke. Okay? So everyone, all of these facilities, in order to stay afloat, just to stay in business, what they had to do was they quit letting so many of their patients stay overnight. Okay, they quit the focus on inpatient healthcare delivery, and they shifted their focus to outpatient care delivery. Outpatient, right? Outpatient delivery. So their shift in focus to outpatient care meant they would close down some of their inpatient areas, their beds and things like that, and they would make more room to develop new departments that are focused on outpatient. Okay, so they would develop more outpatient surgical centers and outpatient, this and that. So anything that they can put in an outpatient department and only give outpatient care, they would do it, and that would be their main focus. Because the cool thing about outpatient care is you don't stay overnight. Okay? You do not stay overnight if you are an outpatient. If you're in outpatient care, what happens is you get your care and then you go home. Okay? That means that the hospital does not have to pay for your food, your bed. They don't have to staff a full room for you. They don't have to pay for all the electrical utilities and everything that is involved in keeping a patient overnight. Okay, so they lose money when they focus on inpatient, and they're only getting a flat rate through prospective. But they're able to stay afloat and make money when they switch to outpatient care. Okay, so switching to outpatient care fostered cost containment. Okay, so that way they were able to save money and contain their costs, not put out so much waste. So here are some trends, healthcare trends that are affecting HR right now. Okay, so first we have hospitals, hospitalists, and changing hospital-physician relationships. So hospitalists are actually physicians. Okay, these are physicians that work for hospitals. Typically, these physicians are going to work under a salary basis for the hospital. Okay. But right now we're kind of changing the physician-hospital relationship, and we're seeing a lot more people being hired by the hospital as opposed to just working with a hospital like back in the old days. Most physicians refuse to work under a hospital and for a salary, and most of them would just, work with a hospital, just have an alliance with the hospital. Like, I bring you patients, you allow me to use your resources, and that's how it works. Today, not so much. A lot of hospitals are just hiring physicians, and many physicians, especially younger and newer physicians, they're okay with that. Okay? Now, we also have decreased reimbursements, which I touched on in the last slide. Okay, decreased reimbursements happened when we switched from cost plus to prospective payment system through Medicare. And when that happens, it's kind of like this trend that never fails. Anytime Medicare makes a really dramatic change, most of the other insurance agencies and other like public health insurance programs that we have in the country, they all follow Medicare. So whatever Medicare does, everyone kind of copies that. Okay, so then we also have a growing trend of alternative therapies. So this is really cool. We're suddenly becoming more open-minded, and we're not always so, we're not completely relying so much on the allopathic medicine that our physicians try to give us these days. Okay, thanks to the internet, we're becoming more empowered, we're learning more things, and we're understanding that there are other treatment options out there. While allopathic medicine is fine, it's okay, maybe for your situation, you may want to have an alternative therapy. Maybe you want acupuncture. Maybe you would rather use some natural homeopathic medication as opposed to some allopathic prescription that your physician gave you. So now we have more choices. We have alternative therapies, and because there is a focus on alternative therapies these days, we are starting to see a trend where many physicians are starting to understand these alternative therapies, and they're willing to give those options to their patients if they're allowed to, because many physicians are not actually allowed to give certain homeopathic or alternative therapies to their patients, okay, or suggest them or anything like that. Then we have interdisciplinary patient care teams. So instead of just a physician working on a patient and like that's it, like the patient says whatever the physician, or patient does what the physician says and that's it, like that's just the relationship. These days, we're seeing a trend where healthcare is more of a team. Okay, we're delivering healthcare as a team, and in that team is also the patient. Okay, the patient is part of their healthcare team. Okay, the patient is allowed to just suggest things and to learn as much as they can about what's going on with their health. And, so then we have our physicians. We have specialists now that actually work with our primary care physicians. Okay, they're teams. They know each other. They might talk to each other about what's going on with your health and things like that. Also, same thing with our nurses and the other people that might be caring for you. Okay, so we have patient care teams, and as opposed to the old-fashioned way where it would just be the patient and the physician, whatever physician says, physician, it goes. Okay, so it's a little bit, we're moving in a different direction now. Then we have recruitment and retention in healthcare. Okay, so we are actually understanding much more so how important recruitment and retention is, especially now, because now especially the millennial generation is coming out into the workforce, and they're taking, they're occupying all these positions, these jobs, and they're becoming professionals and everything like that. Well, the millennial generation typically has a different perspective on how healthcare should work, or how jobs should work in general. Okay, many millennials believe that their lifestyle will come first, and they care about the culture of the organization that they're working for, and they can be a bit picky, and if they're not happy in a certain place, they are more than willing to go somewhere else. Okay, so you see a lot of people of this generation kind of moving from job to job because they're just going for something better, right? So for an organization, it's kind of difficult to retain your high-performing employees when the trend of loyalty to an organization is not really what the millennial generation is all about. Okay, that was like the old way. Unfortunately, though, when it actually costs a lot of money to put into recruitment and retention. Okay, so you're putting a lot of money out there to search for the right employee, and then it usually takes money to retain that employee. Okay, so we're trying to find new ways that we can retain our employees and keep them and things like that. So we're going to see a lot more cultural changes within the organization in the future, because we need to retain our high-performing employees. We don't need high turnover rates and things like that. And finally, we're seeing a lot of entrepreneurship happening. Okay, so a lot more people, especially, I think this has a lot to do with the millennial generation as well, because a lot of us are thinking, they're finding a lot of these flaws within the system. Okay, they're kind of sick of the bureaucracy in healthcare delivery, and such and such, and all of this kind of interfering in our life and the way we want to practice and things like that. So we're just sort of going out there and going, I'm going to start my own company. I'm going to do my own thing. I'm just going to work for myself, whether I have employees or not. So many people are going out there and doing business for themselves. They're creating their own ideal jobs instead.